early screening of school children for mental well-being and learning disabilities right from the beginning. Dr. Harish Shetty, who is a child rights activist, lives in Bombay. In 2016, he had made appeal to the High Court in Bombay, saying all children should be screened at an early stage for any of mental well-being issues, the way you have physical well-being tests in medical exam in schools, there should be mental health exam also, where even learning disabilities can be screened. They can be screened for learning disabilities as well as mental well-being. And if there are any red flags, anxiety issues, peer pressure, those things can get reflected in that. And that can help prevent children from getting pressurized or getting drawn towards substance.
There is a question from Lambodara Sahu. How to address the addiction issue in adolescent age?
Yes, today substance abuse has become a huge issue. Many of the causes of these can be stress from your various factors. Some can be environmental, some can be genetic, some can be, like even substance abuse can be, people can be prone to substance abuse due to genetic reasons also. But today, even the environmental, the societal, cultural milieu has become such that it's a problem world over. But for everything, I mean, rather than, start treating here, like for proper diagnosis and advice, I would say you will have to visit an expert. But as a precautionary measure, which is relevant to today's topic, is early detection. That's why is screening. We are advocating through Margika early screening of school children for mental well-being and learning disabilities right from the beginning. We ourselves are using one app which has been developed by our Australian collaborators, and we are doing it here in Hyderabad. Dr. Harish Shetty, who is a child rights activist, lives in Bombay. In 2016, he had made appeal to the High Court in Bombay, saying all children should be screened at an early stage for any of mental well-being issues, the way you have physical well-being tests in medical exam in schools, there should be mental health exam also, where even learning disabilities can be screened. They can be screened for learning disabilities as well as mental well-being. And if there are any red flags, anxiety issues, peer pressure, those things can get reflected in that. And that can help prevent children from getting pressurized or getting drawn towards substance abuse. That's the cautious preventive approach for that. Once issue is already there, then you have to go to experts. There are a lot of rehab centers, but go to a psychiatrist, start with counseling, go to a person, take the child to whoever he is likely to listen to, he or she, go to a counselor, start from there and start a proper treatment. Don't hide it. You cannot solve it just by being, at your level, if it is an issue already.
This is a question from Subramanya Prasad Surpaneni. Difference between slow learners and dyslexia. Is it necessary to distinguish, and if important, how to distinguish? This is the first question. And another question, do you think personalized adaptive learning programs can be devised for slow learners so that they reach a certain satisfactory level in par with others at primary school level?
Yes, slow learning can be due to several factors. There is a difference between learning disability and slow learning. Slow learning could be when you talk about special needs children and the mental health spectrum, developmental disorders, and learning disabilities. There are a lot of comorbidities. Sometimes slow learning could be due to some physical disability also, or it could be due to anxiety, due to some minor mental health disorders, or could be due to some medical condition. You can screen such a child right at the beginning for learning disability, as well as that's why early detection is more very important, and then give appropriate treatment. As you said, adaptive learning and all that can be introduced as a stage after the assessment.
So, are there any ways to distinguish it at home? Like, are there any signs that a child has learning disabilities?
Yes, there are several tools available today for screening for learning disabilities. We ourselves have done 3,000 children we started with in Telangana region. We screened them, and there are various tools. Many tools are available even on which can be operated by parents or by teachers. And screening is not diagnosis. Screening is only initial screening. When you say red flag, means there is some concern. So if the score through that screening is below a certain level, it's below 14, then you don't have to worry. But if it is above 14, then you have to take experts' help. So screening is the initial stage. And the DALI tool is a good tool which has been developed by our Neuroscience Research Center in Chandigarh, Government of India. So that is available, DALI. It's available on screen. You can just browse through that, first look at that. If you feel some concern, then you take the child to another.
It's an online website for screening.
Yeah. But there are various tools available. If you go to our website, we have in the resources section, Margika, www.margika.org. In the resources section, you will find several screening tools we have given. But don't consider yourself a doctor, even if you are a teacher or a parent, well-meaning parent or a well-meaning teacher. And don't label the child unnecessarily. I mean, idea here is not to label them, but to have see if there is something, are we just imagining, and in what way to proceed.
Sure. And we have Shmuel, so you can unmute yourself and ask your question.
Yeah. Okay, I want to ask you a question. Firstly, very interesting presentation. And I want to ask a question about social aspects of learning and developmental challenges. In other words, I want to ask you what impacts of and social and economic problems on development, learning and developmental challenges by children.
I will speak about both the aspects. One is if children from lower economic background, poorer economic background and socially underprivileged background, these children are and their parents are extremely, as it is. I mean, we work with government school children in India, where who goes to government schools today? The poorest strata of the society. Even a driver who has a permanent job sends his children to private school. So only those who are homeless or migrant laborers and all, such people's children go to government schools. If they have a special child, I mean, that child does not get to live life of a human life. It's not the fault of the parent. It's not because the parents don't have the means. They don't have. So only what they can get in the government school. And if the government school is functioning properly, they get some help. So we went through recently one classic case we saw. There is one child we identified through our screening who has this special needs, he has intellectual disability, and the parents are like from lower middle class background. They send their two atypical children to private school. The child who has special needs, this intellectual disability, they send him to this government school because they do not have the resources to look after. They have to use the best resources for best this thing possible. So this is one aspect if they are from poorer social economic background. Now, what is the impact of this? Naturally, I mean, if you have one or two children in family who are afflicted with this one of the special needs challenges, then we all know that in the kind of society we are, where we just hide everything, these children don't generally end up not studying well or not doing anything, because they are just always kept hidden in the background. They don't get proper support, and then they become like pieces of furniture. Some of them end up dying young or in institutions, and the social economic impact is obvious. It is not helpful for anybody. It's not good for the child himself or herself. It's not good for the family, and it's not good for the society. It's a negative socio-economic impact for everybody. So we are all at a negative, we all face the brunt of it finally, because we are all connected. So there is a huge connection today between special needs challenges or disabilities, socio-economic impact. I hope I answered what you you're asking for.
Yeah, of course. Thank you very much.
Thank you, Shmer. We have a question from Sahil. What is vulnerable age to be more vigilant to avoid such SLD issues?
Right from the beginning. In fact, it's the DALI tool we've been using that has been available from age 5. Let me tell you, it's not just SLD. A lot of times there are comorbidities, and some of these, special learning disabilities may seem like special learning disabilities, but they could be due to other developmental disorders also. So those can be traced right from today. Autism can be even in the child's developmental milestones. You can trace when the baby is right in the second week in US and all, second week of after the birth, the child can be tested for if there are any pronounced developmental disorders. But learning disabilities, I think safer age would be 4 to 5. Today within given resources within India today.